Welcome to the Biohacking the Body podcast with your host, Dr. Jeffrey Tucker. Dr. Tucker has been in continuous active practice for over 30 years in the West Los Angeles area. He has completed advanced education and clinical training in rehabilitation, sports medicine, nutrition, and functional exercise training. Dr. Tucker's guest today is Dr. James Stray-Gundersen, a sports medicine and science doctor, and the CMO, co-founder, and co-developer of Be Strong. Dr. Jim Stray-Gundersen is a world-renowned expert in sports medicine, exercise physiology, and training for sport performance, and is a world-renowned expert in blood flow restriction training. Drawing from his lifetime of experience with elite-level athletes and clinical populations, Dr. Jim Stray-Gundersen is one of the world's leading physiologists and strongly believes that BFR will revolutionize training and rehabilitation everywhere. I'm your moderator, Barry Snyder, and here's your host, Dr. Jeffrey Tucker. Before we get started, Dr. Tucker, can you explain blood flow restriction therapy?
Blood flow restriction is decreasing blood flow to a limb while exercising the muscle releases hormones that aid recovery for patients. Also, athletes can use a band or cuff to restrict blood flow during strength training, which can enable athletes to build more muscle while lifting lighter weights. Hi, Dr. Jim. I'm so glad that you're here to share this time and to have this opportunity to ask you some questions. And before I start, I'm going to just share a little bit of my personal story in relationship to Be Strong blood flow restriction bands. I had first heard about them a few years ago from some other practitioners, and I got a set, and they just sat, which I'm sure is not an unusual story, right? A person buys something, and then they just kind of tuck them away a little bit. And then I actually was in Paris, sitting next to Kathy Smith, having breakfast with her the day before she was getting ready to go to Spain and do the El Camino walk, which is a 1-month walk. And we were talking about new technologies and things that we were doing for better health and fitness. And she asked me about blood flow restriction. Had I heard about it? And I said, yes, I did. And she said, oh, we'll make sure that you start using those. So when I got home, I started to use them 5 days a week in my own personal workout. And I was measuring myself with a body composition analysis. And in that 30-day time, I gained 5 pounds of muscle, which at my age is like gold. So it was really remarkable. So I just want to share that with the listeners in our audience. And I know that you have such a long history of being in academics as well as in medical school, and that you're the co-founder and chief medical officer of Be Strong. So I'm curious, what kinds of changes can people expect using Be Strong blood flow restriction bands?
Thank you for having me on. Specifically, the things people will notice after as few as 5 to 10 sessions is a increase in strength pretty much everywhere if they're doing whole body workouts, and that they have become leaner if they can get around to measuring that. So the two big most notable things are an improvement in strength and fitness and a reduction in body fat.
How about bone density? I have a lot of patients that are in that 30, 40, 50, 60-year-old age range, and we're often recommending that they have DEXA or make sure that they're aware of their bone density. Will this help enhance that?
To date, there are no series of published studies looking at this particular question, but there's plenty of anecdotes. We find that people's fractures heal quicker when they incorporate Be Strong training into their rehab regime. And we had an occasion to train a 69 and 68-year-old couple who were in the habit of getting a DEXA scan every 3 to 4 years just to follow their own bone density. And they got a scan in November of 1 year, and it showed that they had a steady, progressive decrease in their bone mineral density, about on the order of 2 to 3% per year. And at this point, the woman was osteopenic, and the gentleman was on his way there. They ended up starting a Be Strong training program and did it for about 8 months. And then, as it happened, they redid their DEXA scan to see what had happened. And instead of the expected 2 to 3% decrease in their bone mineral density, they both increased their bone mineral density by 5 to 6%, which is actually huge to be able to turn this around without medication or dietary modification, or any kind of other modality for helping bone density. And lo and behold, the only thing that they really changed in their lifestyle was that they added a Be Strong workout 3 times a week.
I think that's fantastic. And many of our listeners are between that age of 40 to 70 years old. And we want them to be able to have every fair advantage that they can. So this seems to fit in really well and easy with it. Any thoughts on cortisol in relationship to these types of workouts?
Well, as you know, cortisol is a catabolic hormone, and it's involved in inflammation and in breaking down of various tissues. Often people that get cortisone or the artificial forms of cortisol as a drug, they often lose muscle and they gain fat. And if anything, a Be Strong workout is the antithesis of that. And we end up producing an anabolic hormonal milieu, which is characterized by increases in growth hormone and testosterone and IGF-1, and not so much in terms of increasing cortisol.
That's good. That's helpful. I often get asked the difference between the blood flow restriction bands themselves versus other types of bands, a more rigid one. Are most people even aware of the differences?
Yeah, great question. Again, as it's happened, we've evolved into, let's say, 3 general classifications of what people do call blood flow restriction bands. There's the first class, which is inexpensive and unlikely to be safe and unlikely to be effective. And that's essentially just kind of putting on any old strap on your extremities and going for it. Things like people use Cub Scout belts, judo belts, a variety of other devices to try to get these effects. And actually, these are the people that do suffer the side effects of blood flow restriction training. Then the other 2 groups can be divided. They both are inflatable, meaning they have a bladder that can be inflated, and in this way they can control the pressure that's going into the extremity, as well as come to the same pressure from one session to the next in the same person, and from one person to another in separate sessions. But these 2 categories are can be characterized by, on one hand, being elastic, meaning that they stretch and they accommodate the increase in muscle volume that happens with muscle contraction, where the other is characterized as rigid, which is just kind of like a blood pressure cuff. When you put that blood pressure cuff on and you attach the Velcro, then the volume contained within the cuff cannot really expand. And so these are said to be rigid devices. And both of these can work, but the elastic devices are much safer because the problem with serious complications with blood flow restriction training is if you cut off the arterial inflow into an extremity. And when you have a rigid device, that's really easy to do. And when you have an elastic device, it's very hard to do. So the elastic devices are a lot safer in that way. They also mitigate something that's called the exercise pressure response. And when muscle is compressed or crushed or not allowed to expand the way it normally does, this elicits a stimulus for high blood pressure. And if you look at experiments where you're using an elastic device and a rigid device, and then you superimpose some exercise on it, like walking, then the rise in blood pressure, which happens with all exercise, the rise in blood pressure is much more profound with the rigid systems than it is with the elastic systems. And that translates into being very much safer for those people that may have problems with hypertension, which is literally 40% of American adults either have high blood pressure or are medicated for it, or about 15% of them don't even know that they have high blood pressure.
You know, what a fantastic point. I have to just share how important that is for our listeners to realize, and the significance of that in relationship to high blood pressure. I'm really into, observation of people's postures, or when I'm looking at a person's bodies, what are the signals that, give me clues as to what's going on with inside the body. So I thought it's a fascinating point that you bring up about the blood pressure. Anything else that you want our listeners to know in that realm?
In summary, elastic systems are safer by design, and they lend themselves to what is, I think, the big untapped market out there for allowing the general population to get the benefits of blood flow restriction training in an affordable and doable manner. So because of this safety issue, often the rigid systems have to be supervised by an expert, but that's not really practical for the layperson to use the device in their home, is to have some expert come by every time they want to use it. Yeah. So the elastic systems are very well designed for providing unsupervised home exercise for pretty much everybody.
Our protocol in the office is to introduce patients to the bands. I show them how to put them on. I show them what it should feel like, make sure I'm going through the safety issues, and then route them to our website so that they can buy a set of the Be Strong bands. So out of curiosity, I know that I've been trying to figure out what's my minimum dose per week. And for a couple of months now, I've been doing it just twice a week for 20 minutes. And I'm curious, what's your personal workout these days with the bands?
The minimal dose for most adults is 3 times a week for 20 to 30 minutes a day. And so that's pretty efficient timing and allows us to get on with the rest of our busy lives. With respect to my particular program, it it's gone in phases. I need to be honest about it. I'm not exactly 100% compliant with what I should be doing, but there have been times when I've done this 5 days a week, and then there have been times where I've missed weeks. I would say that it settles out to somewhere between 2 to 3 times a week, doing a single session where I first put on the armbands and then do 3 to 4 exercises with the upper body. And then I switch to put on the leg bands and do another 4 to 5 exercises in our format with the lower body. That exhausts me.
Yeah. And thanks for being so honest about, the regularity of it. That's just real. Is there an advantage to having all 4 bands on at once, lower extremity, upper extremity, or is just upper extremity versus lower extremity enough?
We usually recommend that people start out with either arms or legs first by themselves. It just ends up being a little bit more of a manageable situation for them. But relatively quickly, putting a band on all 4 extremities is just fine. And then we try to do calisthenics and weights that involve all the body's musculature, so like air squats or even jumping jacks or burpees or that sort of thing. And that ends up making the session even shorter. And so in 15 minutes, you can get a complete exercise using all 4 bands at the same time.
I wrote out some of the exercises that I've been recommending for patients to do with the bands on to help them get started. And for some of them, it may just be put the bands on while you're taking your walk. Others, it could be have the bands on while you're doing some jump rope. And I have introduced bear crawls to them or some kettlebell work. Walking lunges are good. Push-ups are good. Even kettlebell snatches or leg raises and arm raises seem to work well. So I have quite a variety of things that I like to show the patients, but especially the body weight exercises seem to be the most effective. And I know that it seems to be you've landed on the 3 sets times 30 repetitions. Seems to be the number that I hear, but I know that you're really trying to create that fatigue signal. Could you share what that is?
The key to effective blood flow restriction training and exercise is to be able to create a fatigue signal. The way that this works is the bands impede venous outflow out of an extremity. And in so doing, they delay or impede the delivery of oxygen and blood to the working muscle. And if this goes on long enough, and sometimes, there's protocols of three sets of 30 reps, but you can also do 3 sets of 45 seconds of the exercise as another way of getting there. You end up just needing to do enough repetitions so a metabolic crisis can set up in the working muscle. And what I mean by that metabolic crisis is that when you kind of you're asking the muscle to work, but you're not giving it the substrates that it needs to carry out that work. They're getting some oxygen and blood, but an insufficient amount to continue the work in what we would call a homeostatic way. And so what happens is you could think of the muscle kind of running out of gas. And when it runs out of gas, the pH or level of acid in the muscle the pH goes down, the acid goes up, and the amount of oxygen in the muscle goes down. And these things have a consequence of not being able to regenerate enough of the intracellular phosphates or energy currency of the cell during the exercise. And when that happens, things go to hell in a handbasket, or whatever the right expression is. And the body becomes aware of this as kind of muscle fatigue or a muscle burn. There are nerve endings in muscle that transmit this metabolic crisis up to the brain. And the brain recognizes that and then tries to do something about it. And the something is there's an increase in sympathetic tone, or the autonomic nervous system tries to speed heart rate, speed breathing, increase sweating, those sorts of things. And the other aspect of that is that there's a release of neurohormones coming out of the brain. The one that's been best documented is growth hormone. And this goes throughout the body and amplifies whatever local anabolic processes there were. So in this way, that's the mechanism of how you get there. What the practitioner will feel is that the muscles are exhausted, fatigued. You may get a little muscle burn at the time when this is going on. And that's how you know you've got a successful Be Strong session.
That's great. How do you feel about numbness or tingling in the hands while they're doing their workout?
Right. So this often happens if in between doing exercises. Actually, during the exercises, it's pretty darn rare to have this kind of feeling. But what happens is when we take a break, generally our arms go down by our sides, and now our hands are very dependent, and that just accentuates the distension that's going on in the distal extremities. And I feel this is the cause for this numbness and tingling. Some easy fixes for people to try is, if they start to get this, just kind of stick their hands up over their head and see if it doesn't go away. And then the other thing to try is to start incorporating some exercises, or start up that next set of exercise again.
That's good.
If on the other hand, there's another aspect to this, and that is sometimes people will get a kind of like hitting their funny bone feeling on one arm. And sometimes that can be interpreted as numbness and tingling, but it's usually only on one arm. And it usually happens right at the beginning of a session. And if that's the case, you should release the band on that side and readjust it and fasten it again. Because what can happen is, depending on your individual anatomy, it may be that where you put the band ends up trapping a peripheral nerve between the band and the bone, and putting a little bit too much pressure on it, and that elicits those kinds of feelings. But that typically happens right at the beginning of a session, once the bands have just first been put on. And the second thing is, it only happens typically on one side. It's rare to happen on two sides. So there's numbness and tingling from a little bit of nerve pressure on one hand, and then there's numbness and tingling that happens on both sides later on in a session, and that's just generally from increased distension of the extremity.
That's great. I think you gave everybody a little permission to move the band slightly upward or a little bit lower, and that there is no exact spot that it needs to be each time.
There's recommended spots.
Yeah.
It should be below the deltoid and above the bicep on the arm, and pretty much as high up on your thigh as you can manage. Dr. Tucker, going back to one of the other aspects that you just mentioned is these various exercises that you recommend for people. That actually ends up being very helpful. People are a little bit lost of exactly what kind of exercises to do. And the kind of good news, bad news of Be Strong is that the truth is that any exercises will work if they're done in a kind of protocol this way. But that kind of doesn't really help the individual. They're kind of, well, okay, I can do anything I want, but you know what?
Yeah.
And on one hand, we have some general recommended exercises that work well, but we also encourage people to do the kinds of exercises that they like. Just do them with the bands on, and in the kind of format where we're getting 3 sets of multiple reps out of them.
That's great.
On one hand, there's lots of choices, and on the other, as long as they're getting a good fatigue signal, then they're doing it right.
I am often amazed how patients will tell me when I ask them, how long have you been doing those exercises? And it could be as far back as 2 presidential elections ago. And they don't create enough variety in their workouts. So I think that this is an opportunity to remind them that variety is good, right? We're trying to create some hypertrophy and, increase that muscle density and increase, bone mass and help lean them out. And there's something that you and I haven't touched on yet. I wanted to touch on the vascular component. We know that in 2016 or 17, that Larkin paper came out on vascular health as well. And myself as a chiropractor, kind of grew up hearing about the nerves and the influence of the nervous system. And over the last few years, I've really changed what I tell my patients, which is, look, take care of your blood vessels. They'll help take care of the nerves. So using the Be Strong bands is remarkable. So I'd love to hear what you found.
It's the first order of business that we do with blood flow restriction training is we impede blood flow. And the consequence of that is to distend the distal extremity, and increase the pressure in the capillaries and distend the veins. And that kind of situation opens up the arteries as much as they can be opened. And then when you exercise and your muscles contract, the muscle pump, if you will, kind of pushes all this blood out of the extremity. And so what you end up with is this vasculature that's both contracting and expanding over time. And this ends up being a very nice stimulus for increasing in endothelium, and it may be able to do something with
it could involve the mRNA,
any
right?
kind of deterioration around.
Yeah, mRNA is involved, and the
yes,
VEGF and HIF, right?
Yeah. What Larkin showed is that when one does a Be Strong session versus just the exercises themselves, after the workout, he finds increases in mRNA for a variety of factors that have to do with vascular health, from VEGF, which is vascular endothelial growth factor, HIF-1 alpha, which is hypoxable inducible factor, number 1 alpha, and the nitric oxide synthase systems. So, and if these components are upregulated, then it stands to reason that the vasculature is remodeling and repairing and getting better at functioning. And that's really what we see with regular use of elastic BFR.
It is really fantastic. I noticed for myself that oftentimes I will get cold in my extremities, in my fingers. But since using the bands, I definitely have less of that. So that's been a nice, biomarker for myself. And I'm curious if you have a particular time of day that you prefer patients and users to do BFR training.
Yeah, not from the BFR standpoint per se, but just from a logistical one, it's kind of like brushing your teeth in the morning. You get up and you establish a routine where you can go through a 15-minute Be Strong session after you first get up, and then it's done for the day, and off you go to the rest of our busy days. And typically, if we wait till later to exercise, something invariably gets in the way of us getting that done. So it's a very nice way to establish an exercise habit by doing it first thing in the morning.
I think that's great. I think we could summarize so far by saying we want the workout to be purposeful. We want it to be at least 20 to 30 minutes per session. We know that we know the location. Is there a certain range that you want our patients to pump the SFIG to? How much play do people have on their own with that?
A lot. We start out with a general recommendation for pressure for the first time you're doing a session, and it's based on the size of your extremity, which also determines the size of the band. So if you have we have 5 different sizes of bands, and our shortest, smallest band is our number one, our green band, and we recommend that starts at 150 millimeters of mercury. And then red is at 200, and then blue at 250, and yellow at 300, and so on. And but that's just a starting point. What people need to do is they need to take a educated guess, and we're taking that educated guess for them for a starting point. But then what they do with the pressure is dependent on how the session goes. So if they get a really good fatigue signal, then they can use that same pressure again. But if the fatigue signal was less robust than they would want, then they can always increase the pressure in the band 50 millimeters of mercury the next time they're trying it.
That's great. I think the bands, I guess they're possibly could be used for the person that's just reading the newspaper or magazine while they're on their exercise bike. But I know that it goes all the way
as long
up.
as they're exercising, it's perfect.
Okay. And is there any nootropic properties to using the band? This is such a big topic these days for brain health in and of itself, and what can we do for focus and calmness and clarity. What do you think about that?
I would say that the particular topic has not been studied as yet or systematically studied, but again, we have lots of anecdotes of people claiming that their cognition's better and they're more focused, and in general, their overall feeling of wellness is better when they're doing BFR exercises. And I think to some extent this happens with any kind of exercise program, but Be Strong exercise or BFR exercise ends up being very compact and very efficient in the time that it's used, and produces a very robust response to exercise because of the combination of blood flow impediment and light exercises.
That's great. I have a couple of more questions, and one of them, close to what we were just talking about, I have many male patients that are in their 60s or 70s that are coming in and they have hypertrophy of the prostate or even dealing with prostate cancer. And one of the current therapies is to reduce their testosterone to zero. And at the same time now, they're gaining fat, they're losing muscle mass. Is this an opportunity to help them? Are we concerned about, increasing testosterone while they're working out with blood flow restriction, but yet at the same time, they're asking me as their practitioner for something that I'm just not sure we have any answers for yet?
I think you're right. We don't really know the definitive answer to the general question of should you be doing BFR exercise when you have some sort of cancer going on. Mm-hmm. But I think there's a couple facts that we can add to the thing. One is that people with and without cancer have been exercising for literally millennia, and there has been no real epidemiologic data to suggest that those who exercise a lot end up with lots of cancers. So that's one point. And the next point is that when we're talking about prostate cancer and reducing the amount of circulating testosterone and those sorts of things, or breast cancer and estrogen receptors and basically hormonally sensitive tumors, I don't know that the amount of hormone that is secreted is enough to really elicit that system. And so if you will, yes, anabolic hormones are released with Be Strong training, as they are with almost all forms of intense exercise. But whether that's enough to influence the growth of the tumor one way or the other, I don't think we really know the answer to that.
So this is one of my favorite questions to you, which is, do you recommend any supplements on days of use? And then have you found anything with particular, dieters, i.e., today that seems like the top 3 or 4 diets are keto and paleo and vegetarian and Mediterranean. Any thoughts on that?
Yes, I have a few thoughts on that. A place to start is that BFR training is carbohydrate dependent, and meaning that the effects that you get come from breaking down muscle glycogen, which is a form of stored carbohydrate, as well as blood glucose, which is our main kind of carbohydrate. And it's very important to have adequate supplies of those things when you're doing your BFR session. And with these advents of high-fat, low-carb diets or keto diets, these people become chronically carbohydrate deficient if they are really doing a good job with their diet. And in this case, they have a difficult time getting very effective sessions out of their BFR experience. However, there's a nice little quick fix. And firstly, most people who are on these low-fat diets are not exclusively high-fat diets are not exclusively high-fat, and they are getting some carbohydrates, so they are able to fuel their muscles to some extent. And then if they just take a carbohydrate supplement like Gatorade before and during the BFR session, that usually supplies enough carbohydrate for them to fuel the workout. So they don't have to give up their particular dietary practices, and they can still get benefit from the BFR sessions. The other thing to say from a nutrition standpoint is that the amount of protein in the diet is important for whether or not you're going to build muscle and body weight, or whether you're just going to get strong and lean. And so in the case where you want to put on a lot of weight and put on a lot of muscle, you need to have about 2 grams per kilo body weight of protein in the diet. And for situations where you want to get lean and fit and strong, for example, for running marathons, there you would want to have a diet that is about 1 gram of protein per kilo body weight per day.
That's great. That was really informative. And I think that's going to help a lot of people gain a better understanding of the overall concepts of blood flow restriction and working it into their life and using the Be Strong bands. Is there anything else that you want our listeners to know?
Our overall effort is to take a modality that's been in the rehab world and to some extent in the team or the strength and conditioning world when dealing with teams, and be able to apply that to the general consumer and allow them, the layperson, to get the benefits of regular exercise and Be Strong exercise at the same time.
We hope you were listening to this podcast on a run or a brisk walk. If not, get up, have a stretch, and we'll see you next time on the Dr. Jeffrey Tucker Biohack the Body podcast. The Dr. Jeffrey Tucker Biohack the Body podcast is brought to you by Vitazole Topical CBD, scientifically proven to go deeper into your muscles and joints, so you can do more of what you love without limits. Go further. You can purchase Vitazole Topical CBD at drjeffreytucker.com/store. You can check out other Dr. Jeffrey Tucker content and products on his website, drjeffreytucker.com.